We'll get started. So hello, everybody, and welcome to today's pain webinar on why advocacy matters. My name is Mercedes Akinzi, and I am with the Pain Awareness Information Network. You can call us PAIN for short, and I will be your host. And I just want to thank everybody for joining us today. We are so glad that you're here. Before we dive in, I do have a couple housekeeping items. The first thing is that this webinar will be recorded. So if at any point in time you experience an unstable connection or you have an interruption, have no fear. It will be recorded and we will distribute it to everybody via email afterwards. The second thing is that we have 3 panelists with us today, and I'm sure you guys are going to have a lot of really, really good questions for them. Feel free and drop those questions in the chat box below, or you can message me directly, and we will address all those questions at the end of their discussion. And for those of you who submitted questions ahead of time, we will also address those at the end as well. And lastly, we truly want this to be a network and a networking opportunity. So if you would like to connect with others who are on this webinar today, please feel free to drop your name, organization, and email in the chat, or you can send me a message directly, and I will follow up with everybody with information for those individuals via email as well. So that's that, and let's dive in now. So today we are going to discuss a topic that is integral to this network, and that is pain and pain advocacy. Pain is a reality for millions of people, and the impacts extend far beyond physical. It also affects every other aspect of life. That includes emotional, social, and economic. Our goal today is to benefit you, and we want to kind of help you understand why your voice is so crucial in shaping the future of pain care, and kind of provide you with tangible ways to get involved. So whether you live with chronic pain or you know someone who does, you're a healthcare professional, or a seasoned veteran who is in the advocacy space and kind of looking to deepen your impact or explore new strategies, your participation and in this advocacy and policy discussion can really make a difference. So we are incredibly fortunate, as I said before, to we have someone who's not on mute. Just one moment. But yeah, so we are incredibly excited to have 3 esteemed panelists joining us today. First, we have Michelle Grossman from Combined Health Agencies Drive Nebraska. Through her work at CHAD Nebraska, Michelle ensures that critical health programs and services receive the funding that they need to provide direct programming, offer educational opportunities, support medical research, and ultimately improve the health and well-being of countless Nebraskans. So thank you for joining us. Michelle's leadership in this area is a powerful example of how strategic partnerships and focused fundraising are essential to, effective health of advocacy. So we are so pleased to have you sharing your insights today. Second speaker that we have now is Beth Stilitano. She is from Fight the Flame. She's the executive director, actually. And, Beth works with Fight the Flame. Beth's work with Fight the Flame is a testament to the power of patient-led advocacy. By focusing on raising awareness for CRPS, supporting research, empowering patients, Beth and Fight the Flame are directly impacting the lives of those living with complex regional pain syndrome, also known as CRPS. And I'm sure you'll hear a little bit more about that from Beth. She's also demonstrating how focused, condition-specific advocacy can drive meaningful change. So welcome, Beth. And last but not least, we have Ray Blaylark of the Sickle Cell Foundation of Minnesota. Ray is a force to be reckoned with. I can personally attest to that. And her tireless efforts through the foundation, highlighting the critical need for advocacy within specific communities, addressing health disparities, and ensuring that individuals with sickle cell disease receive equitable care and support are so important. Her work is a powerful example of how targeted advocacy can bring out much needed change for underserved populations. So please join me in welcoming Michelle, Beth, and Ray. Their combined experiences and dedication embody the spirit of advocacy and what we're about to champion today. So maybe we'll start with Michelle and move on to Beth and Ray. But can you guys kind of tell us a little bit about yourselves? How'd you get involved in advocacy and what inspired you or drew you to this work?
Thanks, Mercedes. Thanks for the invite to be part of this great panel discussion today. Michelle Grossman with CHAD in Omaha. We're a fundraising organization, but we are actually out always talking about what the great work our 24 member agencies do. So we are constantly advocating for each of our health organizations in the workspace. And we decided to get involved a little deeper, work with policy, because we knew that that was so much more important to help influence and drive policy and public policy to help make improvements in healthcare for all. So we got more engaged and stepped it up a little just because important people came and talked to us and really helped us open our eyes and realize what kind of great things that we could help by dabbling a little bit more in assisting in public policy.
We can't hear you.
I apologize. And thank you, Michelle. How about you, Beth? I'd love to hear a little bit more about your background.
Sure. So this did not come naturally to me. I actually was a teacher by trade. I was injured and had 4 surgeries and then developed this pain disorder that no one seemed to know about. Years and years later, my son, when he was 12, really wanted to help. He was sick and tired of when I said I had CRPS and people said, "What's that?" He really wanted to raise awareness for it. So he started a 5K in Charlotte, North Carolina, and that year he raised $16,000. And we met 20 people, all who lived within a couple miles of each other, and none of us had met each other before. So that's how Fight the Flame started. This September is our 12th annual event, and we now we're a nonprofit. We have a monthly support group. We give out grants for small research projects and college scholarships, and we try to do as much as we can to get the name of CRPS out there and to raise awareness and advocacy for the disease and for the people suffering with the disease.
That's amazing. That's very impressive. $16,000. That's very impressive for someone to raise in their first year. And I know that Ray, you also kind of have a unique connection to your organization. Can you kind of tell us how you got involved in advocacy?
Yeah, I sure can. First of all, thank you so much for inviting me to be part of this panel. I will tell you ahead of time, my internet may go in and out. I'm traveling internationally right now, and so it's actually the start of hurricane season. So my name is Ray Blaylark. I am first and foremost the mother of a now adult son who was born with sickle cell disease. And, I would simply say that my passion in making sure that my son had a quality of life is what drew me down the path of advocacy. And then recognizing that there was this broader need that was impacting more than just my son, but that it was impacting an entire community of people who were living with this condition, and the perceptions socially about this condition really tugged on who I am as a person. I would say that this kind of does come naturally to me. It actually helps me to really find focus in my voice for social change. And this just brings me down the road of health equity. But again, it's about a bigger community and not just one person. And so our advocacy is about improving quality of life, but it's also about ensuring that there is expert care available.
Fantastic. So I'm kind of curious, and Ray, you kind of touched on this, but was there a particular moment or experience that made you realize that advocacy was something you wanted to do or needed to be a part of? Was it just the birth of your son, or was it as you continued through the process with him?
Yeah, to be honest, the what really drove me to the need for advocacy is the reality that sickle cell disease, although often talked about as a Black disease, although it's not, it predominantly, but not exclusively affects people of African and Hispanic descent. However, the fact that 29 years ago when my son was born, I could not go, online and find information. I could not go to my neighbor and ask, can you tell me about this disease that is predominantly affecting our community. No one could tell me. Just the lack of conversation alone let me know that there were unmet needs and that there were misguided understandings, and in many cases that there was going to be bias that was involved in his journey. As a child, what really sat weighty on me the most is that I wanted him to have a life that was comparable to his peers. And in order to do that, I knew that I had to create a voice for the voiceless in this community.
Wow. Anything to add, Beth or Michelle, anything that like maybe personally led you to?
So for me, having the disease, I've now had it for 27 years. When I was diagnosed, nobody had heard of it. So my doctors didn't know what they were. It takes generally anyone 8 to 10 doctors, even today, to get a correct diagnosis. So this disease that's been around for so long, and doctors not knowing how to treat it, not knowing how to recognize it, was a horrible thing. And then years ago, when the opioid crisis began, so many doctors all of a sudden just cut patients off. And our suicide rate is now in the high 40s. And I lost a whole bunch of friends. And it wasn't just for the opiates. Living with chronic pain and living with so much pain is very hard to do, as we all know that. But I decided that I really needed to make a difference. I really needed to get those rates down. I wanted people with the disease know that there were other people out there that they can turn to ask questions, and that even though the doctor said that's not normal in the community that you're in, it is normal.
You know, Beth, I really appreciate, you speaking on that. I am familiar with CRPS, and I've met countless individuals who are suffering from pain that no one can explain. And when they are met with the healthcare system, they are met with doubt. They are met with almost a criminalization of their pain, which is very, very similar to sickle cell disease. And so, when I hear other communities who are not just living with pain, but suffering with pain, right? That, it really reminds us that we are one voice, and that the work that we do, even though we may be kind of siloed within our own diagnosis community, that there really is a dotted line to many, many, many other communities. So when we fight for one, we fight for all.
So I will tell you, if you don't mind me saying, we actually talk about that because if patients, CRPS, go to the doctor, they're treated as drug seekers. And we've talked about that when someone is in a flare, sickle cell, people don't believe them.
That's right.
And it's the same thing. People think that they won't give them medication. They think that they're faking it because it's an invisible disease to most. And there's so many other diseases out there that people do need pain meds, and they don't like being treated like a criminal because they just want to feel better.
I have a habit of, when we talk about the opioid crisis, I've changed my language to say the opioid overdose crisis, because the prescriptions that are written by doctors who are caring for their patients should not be included in a crisis. You are creating a narrative of criminalization of individuals who have a medical necessity. And when we are talking about drug seeking, it is my belief that the person is not drug seeking. However, the diagnosis is, because that's what relief looks like. Now, there is a difference between drug seeking when you are in addiction mode, and drug seeking when you are looking for support for your diagnosis and for a complication that is well noted, it is well researched, it is well known, and yet you still have to walk into spaces that are expected to know and understand and show empathy, and you still have to justify your existence.
Absolutely.
It's really unfortunate, and I'm kind of curious. So advocacy seems to have to start in the doctor's office. What does advocacy look like for your organizations when it comes to interfacing with the medical community?
Well, I can start. I actually think that advocacy starts at home. I think that advocacy starts by removing stigmas at home so that you feel comfortable talking about it in the doctor's office and in public. And because I still meet people who are ashamed because there is a stigma, because they don't want to be prejudged. And so advocacy begins with finding your own voice. And then when you understand your self advocacy, then you can move into community advocacy and representation of a broader community.
Absolutely.
Um,
Anything?
I'll, oh, sorry. For us, advocacy really does start at the doctor's office because we really, really need these doctors to learn about what this disease is, what it looks like, who's affected, and then where to send their patients. When they are diagnosed, where do they send them? I mean, a big project of ours is that we started brochures that explain the disease and explain what the symptoms are, and we try to get them into as many doctor's offices as we can. People write, and I'll send them as many as they want so that they can get them out there. I do believe there is a need at the government level, but right now, for us at least, we need to get physicians to understand. We also need the schools, the medical schools, to teach this more. So for us, that's where we feel advocacy really does start.
Wow. Now, I'm kind of curious. So we talked about advocacy and how it often does start at home. And I think that, Ray, I'm glad that you brought that up. I do agree with you. It does start with simple conversations around the dinner table. And then it leads to conversations in the doctor's office and having to advocate for ourselves there because, as much as we trust and love our doctors, sometimes they don't always understand the struggles that we're going through. But I'm kind of curious, in addition to that, what does advocacy look like outside of the doctor's office? So how do we create a greater awareness of what you guys are experiencing or what the needs of the different communities are? And is there any benefit to getting involved in policy? Or I should say, what are the benefits of getting involved in policy?
Well, I think that what advocacy looks like outside of the doctor's office, one thing that you already mentioned is education and awareness. Education and awareness is everything. It really is the launching pad for any other advocacy efforts. I also think that the lived experience, being able to share your story in a way that is conducive to the audience that you're speaking to, right? I think is probably one of, if not the most important piece of advocacy outside of the doctor's office. I would say the equivalent of that in the doctor's office is being able to describe what you're feeling, seeing, hearing, all of your complications and side effects. But it is important when you are in a in any kind of a policy procedure advocacy situation, it's important to do your homework. It's important to know exactly what it is that you're speaking for or against. It's important to know the history of what's been done or not been done. It's important to know who are the champions on the inside and who are not. I think that many people go into advocacy with no strategy, only voice. And voice and strategy go together in order to be most effective. And then I'm going to add one more, and it is about partnership. We are not lone rangers in the pain community. There are millions of people suffering from diagnosed and undiagnosed causes for pain. And when one pain community does better, we all begin to do better.
Absolutely. Beth, anything to add? Or Michelle, feel free and jump in. But
No, I mean, this is huge because each of you, as I don't remember if it was Beth or Ray that stated, like, we're in our silo for our disease. And what I do is more broader, but whenever we go and talk to groups in the workplace, we talk broad and we always bring in a speaker or someone who has walked the walk and talked the talk from one of our agencies, because I can stand up here and talk to you broadly all day, but when I bring in the breast cancer survivor and she talks about her tremendous journey and what it did to her family during that journey of that breast cancer. It really brings it down for people to understand, because it's always interesting to me when people will look at our 24 member agencies and say, this doesn't really affect me. And I always want to say, that's nonsense. You're lying. You've got to know someone of these 24 agencies. I probably are just an arm's length away from you, because this affects all of us. And so when you bring in a speaker that's been affected, or someone who can walk the walk and talk the talk, it really is eye-opening to those people who may live such a privileged life that they didn't realize that they actually don't. So kudos to what Ray and Beth are doing, because it's awesome.
You're absolutely right. It's so much better to have someone that actually has been through it, because it makes it more personal, for sure. Part of advocacy that we stress is being your own pain advocate. This is something that as soon as someone comes into my group, I tell them, you have to advocate for yourself. No one is going to do it for you. It is remarkable to me how few people know what tests they've been through, know what medications they've been through. People will say they've had injections. Okay, well, what kind of injections have you had? They don't know. The first, I call it, I don't have a name, I just call it my medical dossier, and it lists literally anything that has happened to me in the last, 28 years with this disease. I've listed every medicine I've ever tried, all the types of injections, the tests that have happened, all of my doctors, what I'm currently taking. And if for nothing else, when you go to a new doctor and they want you to fill out forms, you could just say, see attached. But being your own advocate is so important, because no one's going to do it for you.
And I love that you're saying that, because in our community, because there is so much shame and stigma around sickle cell, we have those who and the onset is at birth. So then you have parents or caregivers as advocates, as well as you have patients, or what we call warriors, as advocates. But here's the reality. The reality is that everyone doesn't desire to use their voice in a public setting, in a representation of the entire community. So I do think that it's important that in advocacy, that we spend time helping people to understand self-advocacy. I love that you highlighted, all of the realities of where the gaps are in patient knowledge, right? Far too many times do we take medications and we don't even know the why, or we take medications and the instructions may say, take 2, but we only take 1, right? We have to better understand and more education. And this is dual, right? This is about being taught and learning how to ask the right questions. But it is important, because you can't be a community advocate if you have not first learned how to be a self-advocate. And not everyone will be a community advocate, but everyone must be a self-advocate.
I really like that sound bite. If I could frame that. I love it. I'm kind of curious. So backing up to storytelling, how can people more effectively tell their story? How can we practice telling our stories so that it really resonates with others? Any tips and tricks?
I think, it's interesting, because telling your story is, if you tell someone who's never told their story, they tend to tell it from a deep sorrow perspective. And while, that I think that perspectives of that sorrow are important, it's also important to leave people with a sense of hope, and that they can actually help and do something, even if it's just helping to educate others. One of the things that I see, particularly in the sickle cell community, is that we oftentimes have a very hard time getting, somewhat of influence to be an ambassador, because the stories are so sad. And how do you tell your story with truth, while also leaving a sense of hope in your call to action to whomever you're talking to? And I think that's the trick of advocacy, particularly community advocacy, because we want people to know the down and dirty truth of what's going on. But we also want to make sure that we leave hope to say, but you can do something to help. When people feel like something's too big for them to help, they do nothing. nothing. So you have to leave room for them to feel like they can do something.
People hearing that that I'm a mother, that I had two children, that I'm still a wife, I can do this, to them is most shocking of all. You know, I met someone maybe about 6 or 7 years ago who was ready to end it, and she absolutely could not believe that I was able to be a mother because it was something she always wanted to do. She didn't think she'd be able to do. And I think the fact, yes, it's a terrible disease, but you can find ways to manage it and you can find ways to cope with it and get support and do things. You know, people ask questions like, I love to cook, but I can't use my hands anymore. Anyone have any suggestions? Well, here you go. Even that, just advocating for yourself because you love to do something and you don't want to end it anymore, I think is a good start for sure, if anything.
You know, I also
Absolutely.
think that advocacy is, and I want to say this in the most respectful way, it is questioning the doctors. Advocacy is asking questions of what's being told to you. Advocacy is expressing that, you know, I don't think that will work for me, or here's why that may not work for me, or I have a friend who tried this. Is this something we can try? You know, it's okay to push back. You are part of your team, right? So your voice is just as important as the next person, whether they have letters after their name or not. The letters after your name are patient. And so you still hold weight in that conversation. And you should not be afraid to ask the doctor. Yes, the doctor went to school for a very long time. Yes, the doctor was trained. Yes, there's research, but you are the expert of you, and the doctor is helping to inform that, and you are helping to inform them. And so every piece of research did not include every person. And while we continue to need research, far more research than what we're getting around all pain disorders, it is important to note that research only captures a small portion of people who are affected, which means that there are people who have nuances around their conditions that they do need to be able to speak up and speak out about without shame.
100%. Um, Beth, you kind of talked about this before, but I'm kind of curious. Could you guys all talk about a time where advocacy led to real change, whether it was a small win or something on the policy level? Like, I would love to hear
So I
more
can
about
say, I mean, a little thing for me, this is a personal advocacy. My doctor switched my medication for what I had, and I noticed that my blood pressure was skyrocket. Like every time I went to the doctor, like, oh my God, you're in a stroke. It's two something over. And there was nothing that changed. They kept saying, oh, well, you must be in a lot of pain. Well, I'm always in a lot of pain. That didn't change. So I went back to my doctor and I said, it's this medication. And they said, nope, it can't be. It's absolutely not. And then I saw another doctor. I said, I was put on this medication. My blood pressure is out of control. And they said, nope, that can't be. So after a couple months of really not feeling well on top of things, I said, I want to come off this med. 2 days after I came off this med, my blood pressure read was back to normal. And as it turns out, it's like a 0.005 chance that this could happen, but it did. And no one believed me. And if I didn't keep after them, you know, who knows? Maybe I could have had a stroke. I don't know. But that's why I think patient advocacy, being an advocate for yourself, is just so important. Like I said, that's just a little story, but that personally happened to me.
I love
a
that
win.
example. I love that example because, you know, when physicians talk to you about side effects, you know, they oftentimes tell you the side effects that are most common. They don't necessarily tell you, you know, the rarest of the rare, but the rare is there for a reason, and none of us can predict who that 0.0001 is going to be. And so, you know, doctors are also trained, because I also work in the rare disease world. Doctors are trained that, you know, if you, what is the saying? If you hear hoof prints, think horses, not zebras. Well, by doing that, you literally reduce the voices of the zebras. So how will you recognize the zebra if it comes, if you will always assume that it's a horse? And that has, while I understand the premise for that, I also recognize the immense harm that that has created in the way healthcare is delivered and in the way the patient's voice has an opportunity to carry the weight that's necessary.
Thank you. Michelle, any types of wins? I know that you're involved in a number of different spaces related to health, but I know that you've had some policy experience recently and
Yes, I'm a little bit of policy experience working with some great friends who are guiding me to things that we didn't even have our finger on the pulse of. And it's great to get involved and let the local state senators know and the congressmen in DC about health related issues that are important. And it's exciting to see the things that are going on and how many people get together and work collectively as a group to rally around issues and insurance issues, drug issues. And I think the more we all work together with our voices from all of our different silos that we're in, we are such a huge, powerful group together that can really be a catalyst for change, which is going to offer better health outcomes for all patients in all diseases and disabilities.
and kind of shifting to that policy focus for a little bit, do you guys have anything on your radar that you feel like it might be important for people who are experiencing pain to pay attention to in terms of policy? Or anything with the healthcare system in general that we might want to pay attention to or engage with our legislators on right now?
Well, I can tell you for North Carolina, which is a little behind the times, getting medical marijuana is a huge thing here for patients. Even those who have never even tried it, they want the option to. And medical marijuana is still so far away, but we have people pressing their Congress people and representatives for it for sure.
Yeah, I totally agree. I think that, I think about the warriors that I've served, and I'm glad that you brought up, medical marijuana and even just the overall legalization of it, which is going to help with cost, because access to medical is really a barrier. But what one of the things that I think is really important is how do you take the some of the control of managing your pain back? And some of that is by looking at alternative medicinals that can, in fact, assist. That sadly, our country as a whole has not fully embraced. Right, there are a lot of Eastern medicines and a lot of other opportunities to look at ways of approaching pain that is not mainstream in America, that I think would behoove us, particularly as part of the pain community, because as long as they're the ones who give it and they're the ones who can take it away, my fear is that there will always be a hoop that we have to jump through in order to be treated humanely. And so when we take some of that control back, whether it's horticulture, and learning how to grow, or whether it's understanding the value, of seeing the chiropractor, or certain types of massages and other things that we can utilize. But then it's also, we run a state organization, is to ensure that we have funds that are available to be able to help people who may not be able to access it financially, because insurance still doesn't cover so much of it. And so it's really about working together and creating even that coalition of organizations and efforts and advocates who are bringing resources together for all individuals who are living with pain.
Absolutely. And that brings me to my next point. I'm kind of curious. What websites or networks or resources are you guys turning to stay informed on and engaged on whether it comes to pain or policy or advocacy, news outlets? What outlets are you guys recommending? What are you reading and paying attention to?
Because I think patient advocacy organizations pop up all the time. One of the things that I do around many topics is I put in a Google search and then I do notifications so that no matter where on the World Wide Web that the conversation is going on, it might not come up on a social media feed. I might not get a newsletter. I might be behind on my emails. But when I'm able to get those notifications from Google, I'm able to see things I never even knew was happening, conversations and people who are advocating in spaces I didn't even know, topics around pain and pain tolerance and pain treatment that I look for. Okay, where does that intersect with the work that we are doing? Is there an opportunity to partner in that work? So it really helps to build this broader advocacy network.
I agree. I get my Google posts all the time, and I have it under different things. I have it under pain, I have it under CRPS, I have it under Fight the Flame. So I get a bunch. And you're right, that's what starts me going down my little rabbit holes, they say. Like I'll read that, like,
All
oh,
the
well, let's read
time.
that, and let's read that.
I'm glad to know I'm not the only one who's kind of feeling a little bit like the pain community is very segmented. There's a lot of really good information, but I think that that's part of the reason that we started this network is, pain is kind of treated in silos and the education is kind of in silos. And so bringing everybody together to talk about a central topic, I think is really important. But yeah, no, I'm glad I'm not the only one. I don't know if you have any other resources, Michelle, just because you're plugged into so many other organizations, but
Mercedes, I think that holistic health is so important, and while it's verbalized within the healthcare system, it's not practiced, right? Holistic health, you made a statement about that it's fractured and compartmentalized. I think about dentistry, I think about mental health, I think about pain. There's no justifiable reason that has not been better integrated into even primary care, the way that we are cared for as a whole person. The fact that we have to go outside of the medical system, right? The traditional medical system, to get mental health care, to get dental care, to get pain care. The fact that you can go to a pain doctor who doesn't even know about your condition, but they're expected, your physician is expecting them to be the ones who are managing your pain is pretty close to ridiculous, right? So at any given time, the same people who are suffering with pain, they wear the hat of pain, but then they also have to wear the hat of the teacher. So no matter where they go, they have to be the learner, they have to be the teacher, they have to be the advocate. And that in and of itself actually increases pain. And so we have to make sure that we are approaching this from a common sense standpoint, but also that we are understanding what we are expected to do to advocate for pain in many cases actually exacerbates the pain. And so we really have to kind of unpack how we are having conversations and what is expected of advocacy within the pain community, so that we do not do more harm trying to do better.
Something that Ray had just said about, things not being covered. This years ago, I was published in a publication, and the article after me was from the CEO of a huge insurance company. I'll leave his name out. And he said that he was in a horrible skiing accident and medication wasn't working for him and regular medicine, but acupuncture and physical therapy and massage were what really saved him. Well, none of those were covered under his healthcare policies. I wrote to him right away. Of course, no response. But if these people who run our insurance are realizing that we need to go out of these exact lines, how come they're not, after they experience, how come they're not putting it downward,
I think that a lot of that, and feel free and jump in, anyone, but I think that a lot of that also comes from getting engaged in policy. I didn't realize just how much of the procedures that we go through and in the doctor's office and what's covered and what's not covered, a lot of that is actually taking place at a national level. And so building a relationship with like our local legislators and talking about what we're going through and the gaps in care and access. I particularly think about people in rural communities, or maybe someone who doesn't have transportation who lives in the metro area, for example. How do we address pain if we can't even access the resources that are helpful to us, whether it is massage or acupuncture, or it's the pharmacy. If the pharmacy is 15 miles away because the local one closed because it's no longer lucrative for them to stay open, there's a lot of challenges, but I think that policy seems to be a pretty impactful way to address things like that.
Michelle said, I mean, I'm sorry, not Michelle, but Beth said something earlier regarding what she did in North Carolina, and she started a group, and she found that, people were only blocks away from one another, right? I think that the sense of belonging, right, plays a humongous role in the ability to mobilize, right? There are countless people. They may not have a pain condition, but they've had pain, right? They've had excruciating pain, many, and they were able to go to their medicine cabinet. They were able to get some kind of over the counter or whatever. But imagining that over the counter or that medication wasn't available to them at the time they were in their most excruciating pain, right? Some of this advocacy is about helping people to understand that we are talking to you too, right? Because you can make a difference. Your voice makes a difference. Your experiences make a difference. And then when we go into policy, then what we find is that, hey, some of those people who are in those same communities, who have shared those same experiences, are friends with that politician. Some of them are neighbors to that politician. Some of them, there's only, so many degrees of separation between all of us. And I find that even if our politicians haven't experienced it, oftentimes they may know someone, but they may not know that they know someone. And so once we can connect those dots, now we go from that cerebral conversation with people into a heart conversation. Unless you can connect the dots for people, it's going to stay cerebral. And so you have to approach it as cerebral. But the moment you connect, now I'm pulling out that whole heart.
Yep. Isn't that the truth? Well, anything else to add, Michelle? It looked like you were maybe going to say something.
No, I'm just agreeing. I'm glad that I got asked to be on this panel so I could sit and listen to the expertise that Beth and Ray are providing for everyone. So thank you, ladies.
Yeah, you guys are a wealth of knowledge, and I really appreciate it.
I do want to add another piece of advice around advocacy, and that is we oftentimes think of advocacy with politicians. We think of advocacy with the healthcare system. But I would say that in addition to education systems that I heard someone say earlier, but I also think that within industry, particularly the pharmaceutical industry, being able to tell our story so that they understand the lived experiences as they create new products or as they fight to bring new products to market. I do think that they need to be more involved with the actual patient community, and so that they can hear what are the barriers that patients are having in the healthcare setting. I don't know that the pharmaceutical companies are always fully aware of our barriers as patients. And I do think that being able to build professional relationships with representatives of particularly community and advocacy departments within some of the industry, I think is incredibly, incredibly helpful, because we cannot forget that we have to have champions on the inside of spaces we can't get into.
Absolutely. It's a really, really good point. With just a few minutes left in our webinar, if anyone has any questions, you can drop them in the chat. Otherwise, I am going to pull up the questions from our three people who submitted them on the registration. First question says, how do we encourage patient engagement in clinical trials and guideline development panels? Any intel?
I think that goes back to education. I think clinical trials is a complex issue. I think that people hold very deeply centered values around, what they are willing to put their bodies on the line for. And I don't blame anyone for that. I think that there are lengthy histories across many groups. But what I will say is that when people better understand the purpose of clinical trials and they better understand what their rights are, even within a clinical trial, right? When they understand the why, all of what we do, we oftentimes say, do this, do this, do this, but we really don't give people a run for their money in understanding the why. And sometimes we have to unpack that, and that includes clinical trials. We have to help them to understand that, we don't even get to a cure for many of these conditions unless we have the research. I used to use the saying, no data, no dollars, no dollars, no research, no research, no cure. Data is everything, and the data comes from clinical trials and other research.
Anyone else want to add anything? You're so good at this, Ray. I love hearing you speak because you're just so knowledgeable and you've got so much, you're just chock full of wisdom. The second question says, where do you see pain advocacy going in the future, and what role do you see peer support specialists playing?
So actually, that's something that I am very for, and I talk to my group members about, is peer support for sure. As a matter of fact, like I keep everyone's name and I blind CC everybody. But I say, if you would like to connect to somebody, send me your name and email, and I will put a separate list for people who are willing to help each other and the only people who get that list are the people on that list, because some people are able, they might have heard something in our meeting that they're experiencing, they want to talk to just that person, and then they could be a support system for each other. So I believe peer support is extremely important. I have parents call me, unfortunately, because their child is not getting a fair shake at school. And even though this disease and almost all of these diseases we're talking about are recognized by Social Security or governmental agencies and whatnot, teachers and principals aren't so quick to help them. I had one girl who really just needed, if she was starting a flare, she didn't need to go home, which is what they wanted her to do. She just needed to step out and go sit maybe in the faculty lounge for 15, 20 minutes in a quiet, calm setting, instead of going home and missing the rest of the day. Advocacy, sometimes I think Ray may have said it before, you might not be strong enough to do it. You want to help, but you might not know. And being able to reach out to somebody who has had experience in this area, who just can give you a word of advice or go sit in the meeting with you so you're not by yourself, I think says a lot.
It's also important to note that, and I spent, gosh, I've been in this space for so long, and I spent 8 years in the clinical setting. And I think that we have to remember people who are living with pain, that actually affects your cognitive ability at some point. When you are in so much pain that you just can't even think straight, and you're being asked question after question after question and expected to answer with some clarity and to be able to advocate, to disagree, to, it's not uncommon to become irritable at that point, right? As anyone would. Ask any pregnant woman who is in full-blown labor, you are irritable, right? And that's a nice way to say it. However, the strength of having a peer advocate with you during those times of interacting, whether you are interacting in a hospital setting, an education setting, or a policy setting, the benefits of knowing that there is a peer connection that you can call when you are ready to quit, and but you got to get back on that horse, when you're depressed and you can't get yourself out of bed. There are a multitude of reasons to have peer support, and that support is a form of advocacy in and of itself. So it's necessary, because none of us are designed to have to take these difficult journeys ahead in life. None of us are designed to take the greatest journeys or the worst of them. We need one another.
Isn't that the
I saw someone asked a question about addressing the role of a patient advocate. So I've been talking with there's an organization called the US Pain Foundation. It's a wonderful organization. It's free to belong. They are actually working on that, and I forgot the name of the role they're actually going to call it, but they want to have someone that is able to connect you to your doctor team and speak for you and help you, but have you a part of it. This is a new thing that they are actually working on. So you are right there.
Yes, and I would say that I think that there is a great deal of advocacy that's needed around community health workers. Community health workers is probably one of the oldest healthcare adjacent roles throughout history and across the world. I don't think that it has been fully embraced here in America, but I do think that within the role of a community health worker, you find that patient advocate. Patient advocate is being used in a lot of different ways. You find patient navigator, as I said, community health worker. And so it's important to bring all of that terminology into an understanding of what I believe that the person who asked the question is getting to. How can they help? Right? How can they help me get what I need? And that's really what's necessary. One of the things that I've done is I stand on this soapbox with the medical teams that I work with, and I say the community is part of the multidisciplinary approach because mental health is a huge piece of the lived experience of people suffering from pain. To not have a community to go to not have people within your own community that look like you, that break bread with you, is a very alone and lonely feeling that can exacerbate mental health issues, particularly when you have chronic pain. So it's important to note that if we can play a role by our presence and our support being there for patients, that means that we are helping to improve mental health, which in fact improves the pain. So that just by nature of the fact that we are improving your outcomes makes us part of your multidisciplinary approach. And we should be respected as such.
Absolutely. Last question says, how can advocates work to address inequities in pain care and policy, specifically in areas like securing equitable funding, ensuring representation for rare diseases, and actively dismantling racial bias within the healthcare systems? It's a loaded question, but a really, really good and a really important one.
There's a lot there. That's a lot.
It is a lot, but any actionable steps, in regard to addressing those inequities? What can we do at a policy level?
Yeah, I think that I'm going to go back to what I said earlier about really knowing, doing your homework. If you are fighting in policies, it's important to know where has similar policies been passed, maybe for other disease states. It's important to know where standard of care and practices have changed or shifted. And so I do think that that there are a multitude of ways that you can still show up and make that change.
Absolutely. All right. Well, I don't think I see any more questions here. So just want to give you guys a really big thank you, Ray, Beth, Michelle, for being part of this really important conversation. Whether you are here as a patient, provider, advocate, ally, or what have you, your presence shows a commitment to pushing towards better care and deeper understanding and more compassionate systems. So let's continue to ask those hard questions, share our lived experiences. We heard a lot about that today, and build those bridges across the multiple disciplines. So I do believe that, we can be better together. And I do agree with you on this one, Ray, and Paul Wallstone, that we all do better when we all do better. So I hope that today sparked new ideas and connections. And then just a reminder too, to please look out for information on upcoming webinars and more information about those this summer. And great questions, everybody. We'll follow up via email with some more answers to some of those questions and helpful links and contact information for everybody. But be safe, stay connected, and we will see you next time.
Thanks for having me.
Thanks, guys.
Thank you.
You guys have a great one.